Hello, listener, and welcome to the Southern 7 podcast. I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy, and is recorded at our main offices in Ulin, Illinois. Southern 7 Health Department and Head Start serves the lower 7 counties of Illinois with public health clinic offices and Head Start centers in each of the counties we serve. If you like today's episode, please share it with a friend and make sure to check out our other podcasts on the Southern 7 app, on Spotify, and through our website at southern7.org. Well, listener, have you got your insect repellent ready? Well, here in Southern Illinois, we are knee-deep in mosquito season, which means testing for West Nile virus has begun here at Southern 7 Health Department. In this episode of the Southern 7 podcast, we'll talk with one of our environmental health experts about testing, treatment of West Nile virus, the 3 R's, and much more. So stick around. We'll be back right after this very short message.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Now the warmer weather is here, mosquitoes are working hard to stay around your home. And if those pesky bloodsuckers have picked up West Nile virus from an infected bird, their bite could be deadly. For more information about West Nile virus, visit southern7.org or call Southern 7 Health Department.
634-2297.
Welcome back to the Southern 7 podcast. I'm Shauna Ryan here in studio today with Miranda Adams. She is the Environmental Health Director here at Southern 7 Health Department. Thank you so much. Now, I tell you what, a lot of times when I'm out and talking with people about our environmental health division, the first thing they talk about is health inspections, okay, going into the restaurants. But environmental health here is so much more than that. Give us a little bit of background and some of the things that you do here.
Yes, so environmental health is not what it sounds. It's an important part of disease control and prevention. So rather than focusing on the person or the disease or illness, we focus on the environment in which a person would interact with the disease or illness. So that could be restaurants, like you had previously said, doing those inspections, private sewage disposal inspections, making sure that raw sewage is being disposed in a way that it won't, people and wildlife won't interact with it because it's full of disease, of course. And to also make sure it doesn't pollute our water sources. And we also do water well testing to make sure that, if you have a well, it's the water in it is safe to drink, but also if you have a treatment system that it's working efficiently or effectively to get rid of any, diseases or germs or bacteria that could possibly be in it. And we also, in the summertime, have a vector program where we survey for West Nile virus.
Now, what's a vector? I get asked that a lot, and I don't want to mess that up.
Yep. So it's basically a disease-carrying agent. So like I said, we survey mosquitoes for West Nile virus. So mosquitoes are the vector, and West Nile is the disease that they're transmitting.
Okay, and that's why we're here today, is to talk about West Nile virus. It's spring in Southern Illinois. It's getting hot. It's humid. It's rainy. It's a perfect home for mosquitoes. And one of the things that we are concerned about down here always is West Nile virus, for sure. Tell us about that. What is environmental health doing with that?
Yep, so West Nile virus is a virus that causes West Nile fever, and I kind of did a little bit of research coming on, so I could give a little bit of history on it. It was first found in Illinois in 2001, and by the end of 2002, it was detected in 100 of our 102 counties. Since then, prevalence has gone down through abatement programs and control measures, and of course, it varies year to year, but it has never been as high as it was when we first found it. So, once it was first detected, we're able to control it pretty rapidly through different control measures. 8 out of people that contract West Nile virus will have no symptoms. You'll never know that you had it. if you are one of the lucky or unlucky ones to develop symptoms, they typically present within a couple days to the first 2 weeks. So sometime within that period of the first time that you were bitten by the infected mosquito. Mild cases would be a fever and a headache. It can be more severe, of course, with that would present more of like a rapid onset of a high fever, body aches, headaches, and then the most severe would be like convulsions and death. It can be pretty severe. But again, 8 out of 10 people will never know that they had it. So it can vary. I think it's more, if you're immunocompromised, it's going to, of course, be more severe on you. So there's no treatment for it. It's only management of any symptoms that you get for it.
I mean, it's scary, but yet there are things we can do to protect ourselves and what we need to do there. Tell us about that.
Yep. The way that you can prevent West Nile is just by taking extra precautions when you're outside. So IDPH has come up with the 3 R's, which are reduce, repel, and report. So you want to reduce the number of containers that can hold water. So that may be tires, that may be like a pot that you've got under a plant to hold water so it can, drink from, and also bird baths. It could be something as small as trash on the side of the road, like a can or a bottle cap. They just need very little water to be able to lay eggs and reproduce. Repel is using insect repellent when you're outside, and report is reporting any water that sits for more than a week. So a lot of municipalities will have mosquito control or abatement programs, and if you report it to them, they may be able to focus more heavily on those areas. We also have limited amounts of larvicide that we can apply to certain areas that are more of an issue. And larvicide does not kill mosquitoes. It will just kill the eggs that they lay at the larva stage, so they won't be able to produce any more. They won't hatch. So it will limit the number of mosquitoes in the area by doing that.
So what is the health department doing to help prevent that spread? I know we do testing. Tell us about the testing on that.
Yep. So between the months of May and October every year, we set out at least 2 traps in all of our counties. Each week we go around and collect all of those nets, and we bring them back to our lab here and test those mosquitoes weekly and report it onto the state. If we do by chance get a pool or a batch of mosquitoes that are positive, we of course will alert, our communities in our area, just to be more vigilant whenever they're out, whether that be, just out in your yard, mowing, going to ball games, anytime that you're outside, just to do the repel and try to reduce any standing water that you can.
Well, I know, we're coming up on the time of year too where people have the kiddie pools out.
Yes.
And I always tell people empty those every day, just for the nastiness of them, but also to keep it from being something that contracts. Because sometimes you forget it's out there, maybe a few days.
Or after a rain, making sure that you dump the bird bath out, or keeping it for a limited amount of time, like the kiddie pool, like you said.
Yeah.
So.
Well, now I know, you have some people that have their air conditioning unit with that water run off.
Yep.
Do you recommend putting like a larvicide in that, or
the larvicide is more for larger areas?
Okay.
Like maybe if someone's got a low standing area in their yard or field that tends to hold a lot of water. It depends on the larvicide that we have at the time. They cover different amounts of square footage or acreage of water. So it just depends.
Okay. So is there anything you can do about that? So a person get out there and just kind of stir that around, or what can we do?
We just go out there and kind of throw it in, and it lasts for a certain amount of time. Some of them are 3 months, some of them 4 or 5 months. It depends on the type of larvicide.
Okay. And they can get that from the health department.
We would come out and
personally,
physically put it in there.
Okay.
But we have to take a specific training each year prior to our the startup of our vector program to be able to apply that.
Okay. Yep. All right. Very good. The traps that you put out in the region, is there one in each of the 7 counties? How many of those are going out, and how are you setting those?
Yes, so we try to do 2 in each of our counties. Sometimes we don't always reach that number, and we send out, I send out an email to our staff to try to put them on staff property, whoever volunteers. We try to do in more of a in-town setting, because that's where more people are going to be at, more people are going to be exposed if there is West Nile. But we will also put it out in the country just because of where we're at. We're so rural.
So again, just you're talking to people about protecting themselves and doing what they can with the 3 R's. But if someone actually contracts West Nile virus, is there treatment for it? Can we be vaccinated against it? Is there anything else that we can do?
Yep. So again, there is no treatment for it. It's just management of any symptoms that you may have. And at this time, there is no vaccine for it. It just kind of let it ride its course. And like I said, 8 out of 10 people won't even know that they had it. So very few people that get it will have any of those symptoms.
Okay. Can you build an immunity to it? Do you know?
From what I have read, I think once you have it, you kind of have those antibodies for a while, so that you, it's not saying that you won't ever get it again, but it may be your risk would be lower of contracting it, or it may be a longer time before you were able to contract it again.
Okay. Going back to a previous point, actually, this is something you and I were talking about before we started. I knew there were many different types of mosquitoes, but it's just kind of fascinating to me that we only worry about it with one. So is West Nile virus, I can't talk either, is West Nile virus, does we just see that in the common house mosquito, or do we see it in others too?
I'm not 100% sure on that. Our program focuses on that one, Culex, Pippins, or the house mosquito. It is a smaller mosquito that we're looking for, and it does tend to like the drier summers. It does lay its eggs in water. Our traps do have water in them that attracts them. But we see higher numbers whenever it's a hot, dry summer. So we try to focus on that one mosquito in this program.
Okay. So basically just protect yourself no matter what.
Yes. Yep. That's correct.
Do you have any idea how many different mosquitoes there are? Species?
I don't know. I'm not sure I want to know.
One of those things, huh?
Yeah. And, a lot of, mosquito's mosquito. You don't even think about how many different species or shapes or colors or, the different varieties of them. But mosquitoes can actually get it from birds. So I wanted to kind of talk about birds a little bit.
Oh, sure. Yeah.
They kind of can pass it back and forth. The mosquito could give it to the bird, or it could get it from the bird by biting the bird. So that's why, we also ask people to report any dead birds that they see. Not all birds will die once they contract it, but certain species are more likely to die. So like crows, robins, and blue jays. That's why we only ask for certain birds to be reported, or we can only collect certain birds. It also has to be within a certain amount of time of its death. It has to be so fresh for that virus to still be active within its bloodstream. Oh. So if anybody does see any dead birds that they want to report, we'll make sure it meets our requirements. And if it does, we will come out and collect that, and we send those off to be tested. We do not test those in the house. But if someone does report a dead bird and it does happen to come back with West Nile, that person would be alerted, and we would probably send out a press release, I'm sure, to let the community know that a dead bird with West Nile virus was found in our area.
Okay. Yeah, and going into that, we always let people know if there's been a case. I mean, we don't tell who and all the specifics there, but we do let them know what county it's in.
Or if we do detect any mosquitoes with it as well.
Okay. Very good. Do we need to worry about this with our pets? I hear horses every now and then.
Yeah.
What's
so,
that?
Horses, I think, take it a little bit harder. Other mammals can get West Nile virus, but I think it's just a little bit harder on horses. I have seen, dogs, cats can get it. I'm not sure exactly what those signs or symptoms would be, but it is possible.
Okay, because I know we got a cat, and he eats birds. Yeah. Cats do that.
Yep.
I mean, is that something that...
there's no research saying that you can get sick from a dead bird, West Nile virus. Of course, you don't want to handle a dead bird if you do find one, but as far as West Nile being transmitted to other animals by eating them, I'm not sure if that's possible or not.
Okay, that's fine. The biggest thing is just getting bit by a mosquito that has bit live bird.
West Nile virus.
Okay,
Yep.
that has West Nile virus. So that's the big thing to be concerned about.
Yep.
Okay. Anything else on West Nile virus that we've not covered?
I think we've covered just about all of it.
Quite a bit stuff there. And again, folks, if you want more information, you can visit us online at southern7.org, or you can download the Southern 7 app, or you can call Miranda here at basically it's just 618-634-2297, and you'll get directed to her and her team. Now, quickly, let's talk just briefly, if we can, about some of the other services of environmental health.
Yes. So, kind of to play off what we had said earlier, we do the restaurant inspections, and they're food service inspections, because it's not only restaurants, and a lot of people don't realize that, but we do schools and nursing homes and convenience stores, just basically anywhere that sells or serves food, whether it be fresh or prepackaged. We do bars, they just serve alcohol, there are anything that's consumed. We also do fairs and festivals, so temporary events, we're out there inspecting those as well. And, that's done in an effort to prevent foodborne illness, or rather to educate and help food service employees prevent it.
Right.
So we're really just out there as a third set of eyes. It's not always what you think of when you think of a restaurant inspection. We're really just there to point out anything that they're doing wrong and to kind of explain why that's wrong and what that potential of contamination or the potential for foodborne illness to occur with that activity. So we also inspect private sewage disposal systems as they're being installed. I kind of talked about that a little bit earlier too, but raw sewage is full of disease. So the purpose of those inspections is to make sure that those systems are being installed to current code, which is just there to prevent people from interacting with raw sewage, wildlife, but also to prevent it from getting into our water sources, our water table, where all of our water, drinking water, is pulled from. We do water well testing. We can only test for coliform and E. coli bacteria, which are the things that are, going to make you sick with gastrointestinal symptoms. But if you're wanting additional testing, we can refer you to other labs that will do that. Like if you're wanting to look for heavy metals or, anything beyond what we can test for. And then, like we've talked about this whole time, the vector program, where we survey the communities for West Nile virus in the summertime.
Well, and then coming up on this time of year, we have flooding throughout our region, not every year, but occasionally. And I know in the past, you guys have been talking with people about their wells, making sure they're checking those. And so, a lot going on.
Yeah, it is recommended to have your well tested once a year. Some people may have it 20, 30 years and never have it tested and it'd be completely fine. But, just to monitor the quality of your water, and again, to make sure if you do have a disinfectant system that it is working properly, it is recommended to have that tested once a year.
Okay, very good. Wonderful. So a lot going on.
Yes.
For sure. Okay, Miranda, thanks again. Is there anything else that you want to share today?
I think we've covered it all.
Okay. Well, good. Well, thanks again.
Yeah,
I appreciate
thank you for having me.
All right. We've been talking with Miranda Adams. She is the Environmental Health Director here at Southern 7 Health Department. Well, that's going to wrap up this episode of the Southern 7 podcast. I hope you've enjoyed it as much as I have. I learn something new here every day. But if you'd like more information about Southern 7 Health Department, make sure you check us out online at southern7.org, or you can also download the Southern 7 app from your favorite app store and check us out at any time. A lot of great information on there. From all of us here at Southern 7 Health Department, thanks for listening and have a wonderful rest of your day.